In this video, you will learn what happens with your baby this week, what happens to your body, things to do or consider this week. Feel free to leave a comment if you have questions. Your baby and you have basically been sitting in the same boat for the past 40 weeks. You have been dreading the birth, but it also isn't a walk in the park for the baby to be born, as he or she will be taken away from his or her familiar and safe environment. Normally the baby is now sleeping a lot, but as soon as he or she hears the water break, your little one wakes up. The baby then reaches the uterine wall. It's time for your little boy or girl to be born. At 50.8 centimeters and 3,400 grams, your baby is as big as a pumpkin, as heavy as an angora rabbit, and his favorite position is the fetal position. At the end of this week, week 40, you have officially reached the calculated date. Did you know that only 5% of women actually give birth on their due date? So it will most likely be on a different day than calculated for you. For some, even a week or two earlier or later. So it's really a matter of waiting these last days. Your body is busy preparing for childbirth. This can give you ailments such as abdominal tightening and menstrual pain. Hard bellies are actually exercises to prepare the body for the contractions during labor. So it's good that you have them, although they can be quite distracting. Menstrual pain is also a sign that your body is preparing for childbirth. Even if you are 40 weeks pregnant, you can still suffer from abdominal pain and nausea. Diarrhea can also occur. This is often caused by the pregnancy hormones in your body. And because your baby is so big now, the intestines get a bit squished. It is advisable not to eat too large amounts of food at a time now. Your baby may be ready to be born when you are 40 weeks pregnant, because your little one does not get enough food in the womb. Then the obstetrician or gynecologist can decide to strip you to induce childbirth. Membrane stripping can only be done if the cervix is already a bit soft. If that is not the case yet, labor can be induced by inserting a hormone called prostaglandin into your vagina. This hormone makes the cervix more soft, so that you can still be stripped if necessary. You will probably have noticed that during the last few weeks you occasionally lose some urine when you laugh or cough. This is completely normal, but of course quite annoying. To reduce these complaints, it is advisable to train your pelvic floor muscles. Your midwife can tell you more about this. Drinking less is not a solution, because that is only bad for your baby's health and yours. Going to the toilet on time, even when you don't have the urge, can prevent many embarrassing issues.